My name is Dr. Samplaski, and I want to thank you for choosing USC Urology for your care. This video is intended for men who are considering a vasectomy. Vasectomy is essentially creating a blockage in the tube that the sperm swim through on their way out of the body so that they cannot cause undesired pregnancies. When we perform a vasectomy, the testicle is still in place, it is still producing sperm, but those sperm hit a roadblock and ultimately never reach the outside world. Vasectomy is intended to be permanent. While vasectomies can be reversed, it is expensive and they do not always work, and men should go into the procedure with the mindset that they are done having additional children. Vasectomies are done in the clinic. They take about 45 minutes. If you have a history of severe anxiety with office procedures or dental procedures, we can make arrangements for these to be done in the OR, but we do need to know in advance that these arrangements can be made. Most men do them in the office. Some men choose to have an oral sedative at the time of the procedure. This is completely fine. If you choose to use this option, you do need to have a ride for after the procedure because it is considered impaired driving. At the time of the procedure, we will wash the area off and drape it off with towels. There's one point at the very beginning of the procedure where we do start numbing. We do this with a very small needle. We start by numbing the skin and we numb the entire area. We then make a very small hole, and through that hole we create a mechanical blockage in the vas so that the sperm cannot make their way through. We then remove a small section of the vas. We do this on both sides, and then we put a stitch on the skin. The stitch absorbs and falls out on its own, so you do not need to come back for stitch removal. This happens in about 2 to 3 weeks after the procedure. While vasectomy is a very low-risk procedure, no procedure is completely risk-free. The two most common but least serious complications are infection and bleed. Regarding infections, we do not give people routine antibiotics. They are not indicated and most men do not need them. If you notice anything after your procedure that looks like an infection, let me know and I would be happy to prescribe you something if you need. Regarding bruising, it is not uncommon for men to have a small amount of bruising after the procedure. If you notice more than a small amount of bruising, reach out to me and I will get in touch with you. In general, ice packs, ibuprofen, and snug underwear are important for preventing more than a little bit of bruising, as well as adhering to the suggested weight restrictions. The other risks include pain. There's short-term pain and long-term pain. The short-term pain, most men say that the area is achy for about 3 days. It's not usually too much more than achy. Again, supportive underwear, ibuprofen, and ice packs help with this, and most men are about 80% healed by about a week. There is a condition called post-vasectomy pain syndrome. That is pain that lasts longer than 3 months. This is rare, and when this happens, most men are seen by a medical professional. We don't know the exact reason why this occurs because it is such a small number of men, but reassuringly, if you follow these men, most of them do get better with time. The other risks are unwanted pregnancy. It is very important that you check a sperm test at 2 months. Even with a negative sperm test, there is a very, very low chance that you could cause an unwanted pregnancy. When we check that sperm test, if we do see a few rare sperm, we would check a month later and hope that those rare straggling sperm are just dead and haven't been cleared. After several checks, if there are still sperm present, we would consider the procedure time for a redo, and we would perform a redo procedure. For 1 week after the procedure, no ejaculating if possible, either by yourself or with a partner. That is to allow the area to heal. I always tell people to try and limit the amount of weight that they lift. In general, I encourage them to restrict to no more than 10 pounds for the first week and no more than 20 pounds for the second week. This is to prevent bleeding. And in general, if you adhere to these restrictions as much as possible, most men do very well throughout the entire procedure. It's very important to check a semen analysis at 2 months. USC does not have a reminder system, so I very much encourage patients to set an alert in whatever type of calendar or phone system that they use. I will give you an instruction sheet for how to check the semen analysis. You can either do this at home and drop it off, or you can do it at USC, but all of that information is on the semen analysis instruction sheet that will be given to you at the time of your procedure. Most men have a very smooth course after their vasectomy. We will go over all of this information at the time of your consultation. The state of California does require a 72-hour wait time from the time of our consultation to the time of the procedure, and they actually prefer a 30-day wait. I want you to succeed and make the best decision for yourself. I do have a vasectomy information sheet with all of this information listed on it that I will give to you at the time of your procedure. And if you have additional questions, I would be happy to answer those over the patient portal or via telephone. I look forward to being involved in your care. Most men do very well with the procedure, but certainly I want all of my patients to feel comfortable moving forward and have all of their questions answered. Thank you for your attention.